So the theme of this session 2 is community engagement in civil registration. And we have 4 exciting papers and abstracts that will be presented during this session. But before we begin with the presentations from the various authors, we'll begin with a keynote address by Ms. Amanda Bissex from UNICEF. She's from the Regional Office for South Asia. And Amanda has worked in civil protection for many years and is now based in Nepal. And we've been very fortunate at ESCAP to work closely with her over the years. I just need to find, there we go. Okay, Amanda, I'm giving you presenters rights now, so we should be able to hear you and see you, and I can see you. Fantastic. Good to see you, Amanda. Over to you.
Okay, so I hope you can hear me okay.
We can hear you very clearly. Thank you, Amanda.
Okay, great. So good morning. I'm really delighted to be here today with you and with such an esteemed panel from, I think, Fiji, Bangladesh, Philippines, and Nepal, all countries making significant efforts to ensure strengthening of civil registration of vital statistics. In the past decade, we've witnessed tremendous progress in CRVS in the Asia and Pacific region. The number of children unregistered under 5 years of age has declined from 135 million at the start of the Decade of Action to now 65 million. According to the midterm report of the Decade of Action, most countries in the region are progressing towards their targets for death registration. And in our region, 32 countries with high civil registration completeness rates also are using birth and death registration records for vital statistics. Whilst these are impressive gains, we must not lose sight that 1 in 3 children in Asia-Pacific still does not have a birth certificate. We need to accelerate action to meet the SDG 2030 target 16.9 of legal identity for all, including birth registration, which reflects the importance of civil registration and legal identity for the SDGs. The current pace of progress for death registration is insufficient for countries to reach their targets by the end of the Decade of Action. And most countries in the region will need to make progress in completeness of civil registration to ensure timely and accurate vital statistics. Excuse me. Making sustained and in some cases accelerated progress in CRVS requires us, sorry, just take a drink of water. So making sustained and in some cases accelerated progress in CRVS requires us to take stock of what works, what doesn't, and what we need to prioritize for action. And this research forum is so important for helping us achieve this. And I want to extend my appreciation to you and ESCAP for organizing the event. I'm greatly looking forward to hearing findings from the many and varied research initiatives that are building our evidence base on CRVS action across the region and contributing to global knowledge. As I think everyone of us here today agrees, CRVS is critical for meeting basic fundamental rights and for reaching and measuring the Sustainable Development Goals. Birth registration is the foundation of legal identity, ensures access to basic services such as health, education, political participation, access to banking, a passport, and many other daily functions. Death registration is critical to completing records of an individual's life, facilitating inheritance, and ensuring accurate population data. Together, the registration of vital events over the course of a lifetime provides governments with accurate and timely data needed for policy, planning, and budgeting. We need to accelerate action for CRVS across the region. Strategies including improving services, reducing legal and administrative barriers, simplifying procedures, and greater investment in systems are needed. However, having accessible and simplified services is not enough unless communities also see the value of registration of vital events. In many countries, basic services such as health and education can be accessed by populations without needing to prove birth registration. This is positive as we do not want to exclude children from basic services based on legal status. However, it does present policymakers with a dilemma: how to ensure communities engage and demand a service for which they may not see immediate benefit. Whilst we understand the long-term benefit and importance for policy and planning of accurate and timely data on vital events, This may not be self-evident for all individuals and communities. Disparities also influence uptake in civil registration, which may be institutional, but also influenced by social norms at the community level. For example, naming ceremonies that take time and consultation with family members or religious leaders delay birth registration. Gender norms that stigmatize single mothers are impediments for registering a child without a father's name, even when the law allows the mother to register the child in the absence of her father. Social barriers result in disparities in birth registration levels among children of different social, economic, and cultural backgrounds. It is imperative to engage with communities to address social norms that impede registration and also to find solutions to system problems. For example, in Bangladesh, which I visited last year, service desks have been set up at the community level, which offer a range of in-demand services, which include civil registration. This is a good example of a private-public community alliance to meet community needs for reliable services and which address barriers such as low literacy rates and internet access problems at the community level. Community engagement is also critical for building trust in CRVS services, and trust is linked to demand generation. Public engagement, participation, and generating demand is one of the key areas in the Regional Action Framework on CRVS in Asia and the Pacific. This includes recognition that improving the coverage of civil registration requires individuals and families to know the value of declaring vital events and to be willing to do so. The framework recognizes the universal and responsive CRVS systems are dependent on relationships of mutual trust and accountability between authorities and the public and should be organized and managed in ways that are respectful of cultural and behavioral sensitivities. A question we must ask ourselves, therefore, is how to most effectively engage with communities to ensure that they contribute as equal partners in strengthening civil registration, mindful of cultural and social diversity. Public engagement, participation, and demand generation involves enhancing public awareness on the importance of CRVS. Health, education, social workers, religious leaders, media, including social media, and civil society play a crucial role in providing information about the value of CRVS and encouraging the public to register vital events. Some effective actions include undertaking national campaigns or drives to encourage individuals and families to register vital events, including reaching out to marginalized population groups, undertaking advocacy on the benefits of vital statistics, reviewing incentives and penalties in relation to CRVS, and including representatives of civil society, such as communities and non-government organizations on national CRVS coordination mechanisms. Tools such as stakeholder engagement analysis help to prioritize and development and engagement strategy. Focus groups, surveys, and research into community knowledge, attitudes, and practices can help build our understanding of community perceptions of CRVS, their knowledge of and experience with birth registration and death registration processes, and their motivation to apply for these services. When we engage communities, we are more likely to find innovative approaches for improving CRVS. It is vital to understanding motivation of parents for birth registration, including the incentives communities value for timely registration. Changing behavior often requires an incentive, and when birth registration can be a long and complex process, streamlining services is critical as it is providing incentives to take up the service. I remember the quick gains made in birth registration following Cyclone Pan in Vanuatu, where a concerted effort by stakeholders was made to make birth registration more accessible. I visited a hospital where for the first time civil registration office had been established as a desk in the hospital and was registering births of children before families left. The convenience of the service should have been enough to encourage registration, but actually this was not the prime driver. As the civil registration staff explained to me, the biggest incentive was the photograph taken of the baby that went on the certificate. This photo would likely be the only photograph many families would have to commemorate their child's birth. And this was so important that families waited patiently in line with their newborn for the treasured photo. Birth registration was just a bonus. And in Indonesia, in Surabaya, families are given a card which entitles them to get discounts on goods around town, including stationery, groceries, and other household goods, all important to a growing family. This motivated families for early registration. We should appreciate these initiatives and how they can create demand for an otherwise undervalued service. Demand from local communities is also a critical catalyst for governments to take action. To create effective, sustainable change, community members, particularly parents and community leaders, must understand how and why birth registration and death registration benefits their families and demand these services from government. Only then will behaviours and social norms begin to change. In the ministerial declaration from the second ministerial conference held just over a year ago, countries committed to take measures to remove all barriers to civil registration of vital events amongst all hard-to-reach populations and people in vulnerable situations, including women and children, persons with disabilities, migrants, and stateless persons. One of the best ways to meet this commitment is through engaging those who are most impacted by these measures, the communities themselves. And UNICEF calls for increased community engagement to build the buy-in and in turn increase incentives to establish and expand CRVS services in Asia and the Pacific. So thank you so much for your time today.
Thank you so much, Amanda, and also thank you for giving us some of those really, really interesting stories from some of the countries around our region. Today will be a great opportunity to hear from more of these kind of stories from several countries, and I really, really appreciate all of your efforts in this area and the dedication to CRVS in general. So thank you a lot, Amanda. We will now go on to look at the different presentations from our speakers. Assuming our speakers stick more or less to the time we have allotted to them, we will have a few minutes for questions and answers after each presentation, but only a very few minutes. So if you have any questions, please put them in the chat box. And you will obviously have a chance to interact more extensively directly with the authors during the Ask the Authors element of the session, and that's scheduled from around 10:50 to 11:30 Bangkok time. So our first presenter here, the first person who will present one of his papers. So our very first presenter for the forum is Mr. Neil Singh from the Ministry of Justice in Fiji. And he will be presenting on the positive impact of financial incentives on birth registration completeness in Fiji. So over to you, Neil, and we will be running the presentation from here. Thank you.
Thank you very much, Tanya, and I hope the sound is clear from my end. Yep. Yeah. Thank you very much once again, and let me begin with the positive impact of financial incentives on birth registration completeness in Fiji. So I would like to acknowledge Ms. Treta Sharma, who assisted me in getting this abstract up to date. And she is, as mentioned before by Tanya, is the Administrator General and the Chair of the Regional Steering Group for CRVS in Asia and the Pacific. Next slide, please. Yeah, to begin with, the Fijian government, through its budget announcement, had put in place two separate assistance programs to assist the poor, needy, and underprivileged, and these schemes were for children and individuals. The programs were initiated in 2018 and 2022, respectively. Since Fiji does not have the national ID, the birth registration number was used to identify children who qualified for this assistance. Therefore, the birth certificate was one of the key requirements to roll out such incentives. These incentives weren't necessarily designed for improving the registrations rates, but this was one of the unintended impact. The birth registration rate consequently reached approximately 99% in 2019. Next slide, please. So let me talk about the first incentive, which was the Parenthood Assistance Program. as I mentioned, the Fijian government through 2018 and 2019 national budget announced the $1,000 Parenthood Assistance Payment Program, which we say PAPP, for newborn children effective from 1st August 2018. The purpose of the program was to ensure that no Fijian child starts life without a financial foundation. For eligible children, a bank account was opened in the child's name at a commercial bank, and the government deposited $1,000 into the bank account. Birth certificate was required to open a bank account in the child's name. For the majority of the applicants, the mother was to apply for the program. Now, the applicant is the signatory to the bank account, and the first 500 was available immediately to the applicant, and those funds can go towards the purchase of whatever is required for the rearing of the child. The other 500 stays in the bank account where it will earn interest and can be accessed when the child is enrolled in year 1 of the school. A minimum operating balance of 500 needs to be maintained in the bank account until the child is enrolled in year 1 of the school. Parents were encouraged to deposit the money for the rearing of the child into the bank account, which would drive home the importance of saving and of financial planning for more Fijian families. No fees was charged for maintaining the bank account until the child is enrolled in year 1 of the school. Commercial banks were offering interest on deposits, but the interest rates may not be the same for all banks. Given the incentive from the government, Fiji has anticipated, as I said, approximately 99% on-time registration. That is within 12 months of the date of birth of the child. So in this graph, you'll see the start of the program was in 2018, and the full impact was shown in 2019, where we achieved 99% of the registration. Next slide, please. The second incentives or assistance, which was driven by the government, was the inflation mitigation assistance. The Fijian government rolled out to the people of Fiji an inflation mitigation assistance program on the 15th of August 2022. The incentive was to assist vulnerable families, children, elderly, and underprivileged from the rapid price increase in basic food and other essentials due to imported inflationary pressures. Now, inflation mitigation assistance also showed the importance of birth registration, as for every application lodged, the birth registration number, or BRN, was compulsory, since it is one of the unique identifier in Fiji. This initiative was for 6 weeks. Now, given the positive initiative by government, as you have seen in the previous slide, that approximately 11,000 births were registered within 6 weeks. This included on-time birth registration as well as late birth registration. Now, this was due to increased demand for birth certificates needed to apply for this assistance compared to past 12 weeks. If you see in the slides, in total, only 3,827 births were registered for the past 12 weeks when there was no economic incentive. So we see when there's incentives by government on the child's birth registration, it gives a rise in birth completeness in terms of registration. Now, the likely impact of this financial support program were highlighted during the ESCAP supported inequality assessment project in collaboration with Fiji Bureau of Statistics, involving all key CRVS stakeholders in Fiji. This project aimed to conduct an in-depth inequality assessment of civil registration using available quantitative data in Fiji. Next slide, please. Generally, to sum up, we have observed an increase in birth registration, including timely registration, when financial incentives are implemented by the government. The results so far show a positive impact of these incentives and can provide the necessary evidence to advocate for continued incentives by government to bridge the gap in civil registration completeness. Thank you very much, Danny.
Thank you so much, Neil. And it's so interesting to see how very specific initiatives can make such a big difference. So thank you very much for sharing that with everyone. And I can see that it's also raised some interest from some of our participants. So we received one question here that I hope you can help responding to. It is from Peter Enfston, and his question is, how do you screen qualified beneficiaries on their assistance? Would you be able to respond to that, Neil?
Yes, to some extent. As I said, we use the BRN, and in Fiji, what we see is a person will have only one unique birth registration number. And so once that birth registration number is used, basically that person has utilized the services. So if he comes the second way around, then he may not be able to. So there are screening process in terms of identifying which applicant is entitled for the incentives.
Thank you so much. We've not received any more questions as of now, but I'm sure that you will be receiving a lot of attention in your Ask the Authors breakout room and when we a bit later today. Thank you so much, Neil. It was really great to see you and really nice to hear more about your experiences. Thank you.
Thank you.
So let's move on to our next presenter. And this is Mr. Ariel Ochochan from World Vision International. And he'll be presenting on the first line of defense, perspectives of children and youth on CRVS. This is a really interesting initiative that happened in preparation for the ministerial conference on CRVS, where we really got a chance to hear from children and youth on their perspectives on civil registration. For me personally, that provided so many new angles and perspectives, and it was really, really very interesting and a great motivator for our work going forward. So I'm very pleased that Ariel has submitted this paper. So over to you, Ariel.
Thank you very much, Tanja. I hope you can hear me clearly again. Yeah. Right. Good morning, everyone. I'm very much privileged and honored to be part of this research forum. And before that, let me introduce to you our organization. World Vision is a child rights and child focused organization. It's development and relief organization. And I'm pleased to share with you the perspective of children and youth in Asia Pacific on what for them civil registration and vital statistics mean. Next slide, please. So we entitled this presentation First Line of Defense, Perspective of Children and Youth in Asia Pacific on CRVS. In preparation of the 2021 Ministerial Conference on CRVS, World Vision is happy to collaborate with ESCAP, Child Rights Coalition Asia, UNICEF, and other organizations in conducting the children and youth consultations on CRVS in our region, with the support from Vital Strategies and Bloomberg Philanthropies Data for Health initiatives. We work with 15 in-country child and youth focus and child and youth serving organizations across 11 countries in our region to facilitate this listening to children and youth's perspective on birth, marriage, and death registration, which are three vital events that impacts their life and well-being. Next slide, please. The Article 8 of the United Nations Convention on the Rights of the Child protects children's rights to preserve their identity, including their nationality, name, and family relations without unlawful interference And in addition, states are required to help children regain any aspect of their identity that has been taken away from them illegally. And so we say that every child should be born and known. However, as mentioned earlier by Rachel Bevan and Amanda in their opening remarks, and according to UNICEF study, around 55 million under the age of 5 in our region in Asia Pacific are not registered. Although we have seen significant progress to strengthen CRVS in our region, the findings of the consultations revealed that there's still much to be done to ensure universal and responsive CRVS. Many children and young people among the most vulnerable sectors that are not able to access CRVS services. Thus, we need to hear their voices, these young voices, and consider their recommendations, their perspectives in policy making and in decision making on CRVS as it impacts their life and well being. Next slide, please. So, what we did in 2021 is during a pandemic with all government restrictions, we have collaborated with group of researchers to design the consultation that fits the context of each countries and respondents. The design of the consultations followed methods and principles of research, primarily qualitative, that employed both offline and online instruments, focus group discussions, one-on-one interviews, and survey. It aimed to capture the range of the salient among the expressed views in response to open ended and pointed questions on birth, marriage, and death registration. Ethical, meaningful, participatory approach in country level um, children and youth consultations and are also validated in a regional forum with children and youth representatives from these participating countries. We have a total number of 561 participants, to which 355 of them are children aged 6 to 17. 206 of them are youth aged 18 to 24, and these are coming from different subsectors of children and youth. Children with disabilities, migrant children, um, refugees children, among other sectors. As mentioned earlier, we conducted these consultations in 11 countries from Afghanistan, Bangladesh, Cambodia, India, Indonesia, Nepal, Pakistan, Philippines, Samoa, Sri Lanka, and Thailand. As you might have seen, each these countries are coming from different sub-regions in Asia Pacific. And as child-focused organizations, we ensure the child safeguarding protocol are required and adhered to ensure all respondents participate a child-friendly, age-appropriate, and safe consultations. Now, as a result of this consultations, a report was developed, Getting Children and Youth in the Picture, and the finding says that over 80% of the children and youth had direct or indirect experience on registration and shared the impact it had over their own or other people's lives. Registration is important for them, children and youth, as they shared both favorable or positive experiences and challenges on CRVS. The report also highlighted the two key important players in a successful registration: government and the parents or their caregivers. They mentioned that there are certain institutional barriers that affects the CRVS services and CRVS related agencies, policies, and practices. Children and youth believes that government has a key role in making sure birth registration is accessible by parents and children even in the far-flung areas. And the parents are also responsible to make sure their children are registered after birth. The lack of registration for children and young people is an intergenerational concern. If you don't have birth certificate, it's difficult to get married. And if parents doesn't have marriage certificate, their children will not be registered. And it's also difficult to acquire death registration without either birth certificate or any marriage certificate. To address the barriers, our respondents call all CRVS stakeholders to include them in the decision-making process to ensure CRVS is accessible to all and leaving no one behind. As an organization working on this consultation, we reflect and we realize that there is potential and power in engaging children and young people because their perspective and their experiences are owned by them. And if we learn from their experience, we'll be able to address causes of these barriers from their lens and perspectives. Next slide, please. And very briefly, to share with you some findings, conclusions and recommendations from these consultations. Children and youth highlighted the important role of government, as I've mentioned earlier, in streamlining registration process. That's very important for them, while strengthening capacities, reaching rural locations, and digital infrastructure. Because for them, the cost of registering birth is too high, especially for people living in poor, rural, and marginalized locations. And the cost of travel from far-flung areas or mountains or islands, for example, to get themselves registered is still an issue for them. And many children are have observed that there are still parents giving birth at home, and one of the reason why um, their these newborn babies are not registered. They also have seen um, help from NGO community and the CSO community as intermediates in birth registration. Some children mentioned that there are local organizations, NGOs, and people's organization helping um, um, parents who cannot afford birth registration of their children to get birth certificate and connect to a local registrar. For children and youth, to guarantee that all births, marriages, and deaths are recorded, and to reduce the consequences of non-registration, stakeholders must consider the recommendations. Civil registration for them is the first line of defense to protect every child and youth and to access the basic services and fulfillment of their human rights. Without birth registration, they do not exist in the eyes of the state. For children and youth, ensuring that everyone is registered requires a collective effort. Birth, marriage, and death certificates are more than just documents for them. These papers demonstrate how much stakeholders care about them. And by including every child and youth in the picture, upholding their first line of defense, they become less vulnerable and more protected. For some children, the consultations was an eye opener as it helped them learn more and contribute in advocating for an inclusive civil registration. And I would like to quote a participant from Afghanistan. She said, "We did not have information about some issues. For example, death registration and also about marriage registration. The consultation should be continued and, and she recommended to be applied. Hence, the children and youth statement was delivered during the second ministerial conference on CRVS, and we're very much happy for providing this space to hear and amplify the voices of young people. It was attended by over 400 participants, including ministers, senior officials, and stakeholders from 48 countries and 15 international and civil society organizations. Currently, children and youth are working with civil society organizations and NGOs, advocates, and collaborating with our local government to raise awareness on the importance of timely, responsive, and inclusive birth, marriage, and death registration. Thank you very much.
Thank you so much, Ariel. This was indeed a very inspiring presentation. Thank you. I'm wondering if anyone, we have a couple of minutes for questions. If anyone has any questions for Ariel. I think we have received a question here, but I don't think that's directly to you, Ariel. Does anyone else have any questions? Ariel? Otherwise, yeah, I would say, so there was a little video made from some of the participants, and the speakers at the ministerial conference, I think, were some of the most inspiring speakers we had. So it was really a great effort from World Vision and colleagues, and highly appreciated to hear these voices. I mean, it's so important. These are the people that we should be helping, right? So important to hear from them directly as well. There is a question here from Suman Rothte, one of our colleagues from ESCAP. The question is, I just have a question on whether relevant government personnel, either at the national or local level, were present during the consultation. And if they were, what were some of their opinions on the approach?
Yeah, I think that that is a good question. Because of the limitations of the pandemic, so what we did is that our partner organizations, locally based organizations serving children and youth, and it's also a child-led consultations, and to make sure that children and youth's perspective are not influenced by service providers. The consultations did not intend to include government leaders in that consultations. However, the organizations, the local organizations facilitating the consultations also shared the results of the consultations to their government stakeholders, to augment their existing efforts on addressing barriers on the challenges of CRVS. Yeah, thank you.
Thank you so much, Ariel. And actually, a related question from me. What did you do to protect the participants? Because these are children and youth, right? So obviously, you need to make sure that there's a lot of safeguarding in place. And you did mention a little bit, but maybe you could elaborate a little bit on what you did to protect the participants.
Right. So all children, especially age below 18, are required to submit their parents' consent and their individual consent. Um, and the consent form states that all their statements and photos and videos and other materials that relates to them um, will be used only for this purpose. And all um, others involved, like facilitators, note takers, even us researchers, we signed the safeguarding protocol, the child and youth safeguarding protocol, that adheres child protection measures to ensure all participants and respondents, from the in-country consultations to the virtual regional forum when we validate the results, up to their engagement to the second ministerial conference, are are documented. And as an accountability, um, we also make sure that these children are provided briefing and debriefing every after their engagement, may it be at the in-country consultations, at the regional virtual forum, and even their participation in the second ministerial conference on CRVS. Thanks, Tanja.
Thank you so much, Ariel. That's very helpful, and obviously you're experts in this area, and it's very nice to see these very thorough processes being followed. Okay, so I think we haven't received any more questions, but again, I think you might get quite a few participants in your room. They'll have more questions on the approach. So we'll move on to the next speaker, and now we'll be listening to Dr. Shah Ali Akbar Asafri, and he's from the Directorate General of Health Services in Bangladesh. And he'll be presenting on lessons from implementation research of the Kalingai model, a sustainable project to improve birth and death registration in Bangladesh. And probably, as many of you know, there's been a lot of efforts over the last few years in Bangladesh, and we're really pleased that we can showcase some of these efforts in the research forum. So over to you, Doctor.
Thank you, Ms. Tanja, and welcome to all those who participated in this CRVS Research Forum. In Bangladesh, basically, we start the civil registration and vital statistics activities since 2012, when we conducted our rapid assessment and of the readiness of the country for the CRVS, and later on the comprehensive assessment on the CRVS. And at that time, we find out that the birth registration, according to the Birth and Death Registration Act 2004, or it was very less. So, and later on, with the support from Bloomberg Data for Health Initiative, especially vital strategies and the CRVS component of the vital strategies, we, from the government of Bangladesh, we identified a model, that is the Kaligans model, for improving the birth and death notification and the registration. That was started in the August 2016 at the Kaligans Upazila. Upazila means it is a sub-district under the Gazipur district of Dhaka division. Administratively, Bangladesh, there is a 4 tier of administration. There is a division, district, sub-district, and union parishad, that is the union council. Basically, the union council at the rural area, they are the registration point, especially for the birth and death registration. At the municipality and urban area in the city corporation, basically they provided the birth and death registration certificate, complete the registration and certificate. And some area that is governed by the Minister of Defense, especially the cantonment area, the cantonment executive officer, basically he or she provide the birth and death certificate. So we, with the support from that I mentioned, that with the support from the Bloomberg Data for Health, we try to identify a model, that is the Kaligans model. So in 2016, a group was created with the different important stakeholders of the health to enhance this effort to scale up this model throughout the country. Different important stakeholders of health means there is a 2 division. One is the health service division, and another one is health education and family welfare division. So under the health service division, there is at the rural area, the health assistants, basically they are responsible for the notifying the birth and death to the local register office. And under the family welfare division, the family welfare assistant, and basically they are responsible for notifying these events. And the focus of this research was to identify the main barriers and success factors of the Kaligans model. That is a pilot test in the Kaligans Upazila of the Gazipur district on the birth and death registration. Comparison with the non-intervention sites, and to make specific recommendation for replicate the model across the country. Next slide, please. Next slide, please. Okay. The methods, basically the study duration, it was previous slide. Yes. Study duration was 6 months, July 2019 up to the December 2019. And study design was embedded mixed method to design, and data collection methods. There is a qualitative interviews, that is the key informant interviews, and the in-depth interviews and focus group discussions, and quantitative interviews, that is the exit interviews. Next slide, please. Yeah, study population in-depth interview. As I mentioned that the sub-district, that is the Upazila, there is a one designated health officer. His designation is Upazila Health and Family Planning Officer. And there is some supervisors, that is the health inspectors, health assistants, and there is a executive officer from the administration, Upazila Nirbahi officer. The Union Parishad chairman, basically Union Parishad chairman, they are the registrar by law. And Union Parishad secretary, he or she is a secretary, support secretary to Union Parishad chairman. And Union Parishad member, basically Union Parishad chairman and member, they are elected personnel. Union Digital Center entrepreneurs, village police, and social welfares. By law, the village police basically they are also responsible for birth and death notification and birth and death certificate distribution from the Union Parishad to the respective family members. So in-depth interviews done with these officials. And key informant interviews, that is the policy makers from the cabinet division of Bangladesh, as because the cabinet division basically coordinating among the different divisions, directorates, and ministries for the CRVS activities. And Office of the Registrar General, and ICT division, and the Home Ministry. ICT division, basically they are providing the digital solution, and Home Ministry is also required for the birth and death notifications. And managers from the stakeholders organization like UNICEF, Plan International, and focus group discussion with the adult male and female group from the local community. And exit interviews, inclusion criteria in individuals visiting the Union Parishad office for the birth and death registration, and individual visiting the immunization center for immunization of a child whose birth already has been registered. Next slide, please. Sampling technique. Purposive sampling technique was used for selection of in-depth interview, key informant interview, and focus group respondent. Quantitative data was collected from all respondents who met the inclusion criteria for 10 consecutive working days at each center of each union. And study tools for collection of qualitative data, in-depth interview, key informants interview, and the focus group discussion guidelines were used. For collection of qualitative data, structured questionnaire was used through ODK platform. A total 9 key informant interviews and 41 in-depth interviews and 4 focus group discussion and 346 exit interview survey were conducted. Next slide, please. The result, we have organized the finding on the registration process in the 3 steps. That is, first is the notification, then the registration and certification, and the distribution. In inversion side, the notification of the birth registration was facilitated actively by the health workers at the community level. Health workers means the both health assistance and family welfare assistance. And linking the birth registration with the immunization activities, that is the EP activities, strong administrative leadership, and successful verification of necessary documents. Next slide, please. Result, implementation barrier, a barrier related to human resource. This is the major constraint. Financial constraint, poor internet connectivity, and low capacity of the registration server. Is because the in the rural area, the some part of the rural area, the net connectivity a bit poor, and there is a more than 5,000 registration point all over the country. So during the morning time and during the office hour, the registration server that not much that capacity. No definite assigned person for the certificate distribution. Though it is mentioned in the Birth and Death Registration Act 2004 and Birth and Death Registration Rules 2018 that the village police basically will assist the certificate distribution from the union parishad to the respective family members. It is mentioned in the act and the rules, but the process is not working properly at that time. Implementation drivers, that is the strong coordination between the Ministry of Health and Family Welfare, Ministry of Local Government and Rural Development, and the supervision. As because the officials or the health workers from the Ministry of Health, basically they are notifying, and Union Parishad chairman and members, they are under the local government division, that is the Ministry of LGRD. And so there is a good coordination on between the two agencies and the good supervision also. Enforcement of the amended Birth and Death Registration Act, linking the registration with the other services, as the birth registration is linked with the immunization, that is in the immunization card, the child immunization card, it is mandatory to mentioning the birth registration number in their registration card, as well as in the EPI immunization registration book. It is already linked, and the birth registration is mandatory for the kids during the admission on the schools, and personal commitment of the staff involved. So next slide, please. So result notification, that is the timing of the registration by act and rules. It is clearly mentioned that these events should be notified within the 45 days of occurrence of the events. So birth registration, the timing of the birth registration by the study site, intervention site, it is within the 45 days, it was 71%. And after the 45 days, it is near to 29%. And non-intervention site, it is within the 45 days, it is the 52%. And after 45 days, it is a 48% or more. And death registration site and the death registration on intervention site, 5 of 7 of the registration were completed within the 45 days. So so it is very good as because the death registration is mandatory at the intervention site. There is a smart verbal autopsy activities is also going on. So is for the smart verbal autopsy, the VA ID is linked with the death registration number. So without the death registration, completion of the death registration, the health assistant or family welfare assistant, they could not complete the smart verbal autopsy. So it is good at the intervention site. Non-intervention site, one respondent could not remember the time of registration. So, and we checked the EPI cards, that is the immunization card, that the 64% of the checked EPI card did not have the registration number, though it is clearly mentioned in the government letter that the health workers, those who completed the birth registration, they should mention the birth registration number at the immunization card. 32% of those who did not give the registration number crossed the 45 days time limit. And no one had the registration number in the non-intervention site. So next slide, please. So conclusion and the recommendation, that is the strong coordination between the relevant partners of the government and strong leadership are essential to successfully scale up of the Kaligans model. As the cabinet division, basically they are coordinating among the different divisions and ministries and directorate, like the directors of the health services, local government division, and the directors of the family planning. So there is a good strong coordination by the cabinet division, and generating the public demand for the registration through raising the awareness about the benefit of the registration and Birth and Death Registration Act and linking with the immediate benefit is a crucial step forward. So from the Office of the Registrar General and during the immunization activities at the EPI site, so our health workers and the local government officials, they are basically communicating with the local people for the awareness of the completion of the birth and death registration within the 45 days. Clarification of the payment condition for the registration, that is it is clearly mentioned that if they complete the registration within the 45 days, there is a no fee. After the 46 days to 5 years, so there is a small amount of fee is applicable, and after 5 years up to the anytime, so there is also some fee applicable for the late registration. And focusing on bottom-up planning and improving the resource management will improve the effectiveness and efficiency of the resource utilization, that I already mentioned, that the resource, basically the resource in terms of the net connectivity and the server capacity and the secretary at the Union Parishad councils, their capacity building is also important. Strengthening professional development and performance management of the human resource through targeted training that mentioned, assessments and incentives will improve the quality of the service. Next slide. And clear assignment to tasks to specific stakeholders and ensuring adherence to official job description will streamline the registration process. That in the act and the rules, there is we are basically orienting our health workers, that it is clearly mentioned that the health workers basically responsible for the notification, and the registrar, he or she has some specific task, and from the Office of the Registrar General and the Cabinet Division, basically they are also orienting the Union Parishad Council chairmen who are the registrar and his or her secretary, and mentioning that this is the task, that is the completion of the registration process and distribution of the certificate and the linking with the health. So, so by this way, basically, we are orienting about the act and the rules among the officials. Strengthening the monitoring and supportive supervision through the activating the CRVS task force. CRVS task force already formed at the Union Council level, at the district level. So basically, they are monitoring and the supporting supervision, providing the supporting supervision. Generating the demand for the birth and death registration data, not only within, but also across the ministry is crucial for successful scale up. And investing in the integrated service delivery platform. This is the dream of the government of Bangladesh, that is the ISDP, integrated service delivery platform, to recognize the every individual by his or her unique ID that we call the UID, and work together. A sustainable CRVS system is crucial for preparedness for universal civil registration. Next. And thanks to all. So any question and comments?
Thank you so much, Dr. Asrafi. This was very, very interesting, and I really liked how you highlight the links with the health sector and the vaccinations, and how that has is really key to the improvements. And also what I really like that you mentioned, which we don't often mention, but is really important, is the personal commitment of the staff. And I also saw that some of your recommendations was about human resources and supporting staff. So that's really wonderful. We have just 2 minutes for questions, but there is a question from Jeff Montgomery, who's with SPC, and his question is, well, nice to see you again. And are there plans to scale up the pilot across from Bangladesh? Is there an expected time frame?
Yeah, by this time, the Caligos model basically scaled up in the rural area. It is already scaled up, and from the cabinet division and the office of the Registrar General and the Directors of the Health Services basically participating in the different meetings and with the stakeholders like the Deputy Director of Local Government and Union Parishad Chairmen and the civil servant, surgeon of the from the health department and the sub-district level, that is the Upazila Health and Family Welfare officer. So basically, we are orienting them. And it is by circular. It is already scaled up in all over the countries. So right now, the birth registration improved, tremendous improved according to the time frame that is mentioned in the Birth and Registration Act and the rules. That is the within the 45 days. It is tremendous improved, and simultaneously the death registration also improved. And the government of Bangladesh have a commitment to the UN ESCAP that the 100% birth registration within a year by 2024 and 50% death registration within a year by 2024. And hopefully at the end of the CRVS decade, we will reach that goal.
Thank you so much, and I see you get an applause from Jeff as well. And of course, also thank you for a shout out to the Asia-Pacific CRVS Decade and the shared commitments that everyone has made. I think we will have to move on to the next speaker, but everyone will get a chance to ask more questions about this very exciting project when we go to the Ask the Authors sessions. So the last speaker for today is Mr. Surendra Prasad Pandey from the University of Melbourne, as well as from the Ministry of Federal Affairs and General Administration in Nepal. And his presentation will be on differentials, barriers, and enablers of death registration in Nepal, evidence from the Civil Registration and Vital Statistics CRVS survey. And I have to admit personally, I'm quite excited to hear this presentation because this is one of the very few surveys I know about that has specifically focused on getting more evidence into why people are not registering and the registration rates and so on. So Nepal was really a front runner in this. So thank you so much for submitting this paper. I really look forward to your presentation. Over to you.
Thank you very much. Hi, everybody. I'm Surinder Pandey, and good afternoon from Melbourne. Yeah, this is our paper entitled Differentials, Barriers, and Enablers of Death Registration in Nepal. And it was evidenced from the CRVS survey, which was conducted in 2015-16 in Nepal. Next slide, please. I acknowledge all these institutions and organizations for their different kind of support I got while I was working within the government of Nepal and during the journey of my PhD journey within the Melbourne University. Next slide, please. Yeah, basically the civil registration CRVS system has major two functions. One of them is the legislative kind of function, that is administrative and legislative in the form of the timely registration of events and issuing the event registration certificates, including birth and death registration certificates. And another is the major part, which is the produce vital statistics, the timely and reliable vital statistics for as a policy evidence. The after 2014, ESCAP Regions Ministerial Conference on the CRVS system, Nepal has also initiated some important steps. One of them was to conduct the CRVS survey. It was jointly conducted by the National Bureau of Statistics. It is now called the National Statistics Office, and another is the amendment of CRVS legislations. They were around 44 decade old legislations and were not relevant in the present context, and they have been now amended. And another one is the implementation of the CRVS policy 2019 is another crucial policy document. And another is that the still to date, different countries like Nepal, the major source of the data, like the vital statistics, are some periodic census and the surveys, and they might not be relevant due to their timeliness. But to get the timely and reliable data, the CRVS system should be used as a primary source. And the CRVS system in Nepal has, despite that importance, unfortunately, still not started to produce the, reliable vital statistics using the civil registration records. And yep, next slide, please. As I told you about the CRVS survey, it was the first initiative by the government of Nepal to collect the baseline data on the CRVS system and to estimate the targets for the CRVS decade. It was the like a stepping stone towards the government's initiatives for CRVS strengthening. And it was administered in both households and the local registrars. It was one unique kind of survey in Nepal and possibly in the world. And the CRVS survey collected information about main 4 kind of category data. Registration status of 5 major events which have been registered in Nepal under the civil registration system. Reasons behind registration, not registration, and major barriers and enablers of death, event registration, and possible remedies to extend the civil registration and meet the CRVS decade targets. Next slide, please. As I mentioned earlier, the major objectives are to understand the differentials in death registration in different aspects like the socioeconomic and the demographic aspects, and the reason behind the registration and the non-registration of deaths in Nepal, and identify the possible ways to enhance the death registration coverage and make registration more convenient from both households and the service provider. They are local registrars point of view. Next slide, please. We just did use the CRVS survey data, and it was, I want to tell you some bit about the CRVS survey. It was national representative survey and conducted among 80,000 households throughout the country, and conducted in two phases. First phase was in the Himalayan mountain region in 2015, and later was in the remaining two regions, Hill and Tarai, in 2016. And in survey, different range of questions were asked about. I'm focusing on the death, but all 5 events were asked there. And at first, the filter question was asked whether any event deaths were occurred in your household or not within the 3-year reference period, and whether they were registered, and the reasons behind registration, and if not registered, the major reasons behind not registration. Next slide, please. And for this study, we used both bivariate and multivariate data analysis techniques, and we also used our previous study to compare our estimated completeness of death registration, and we also used the logistic regression for multivariate analysis to access the likelihood of different predictors like socioeconomic, demographic, geographic, and death characters on the death registration status. So if death is registered, which factor more likely influence household to register death in their households? Next slide, please. And it also asked the reasons behind. We also analyzed the reasons behind the registration, non-registration, and households' perspective, the ways to improve the registration, how they feel easy to register deaths, and service providers also asked to make registration more convenient, ways to make registration more convenient. Next one, please. This is the snapshot of the comparison. As I mentioned that we also did one study. We estimated the death registration completeness from the CRVS, civil registration, using the civil registration data and an empirical completeness method. And these are quite close together. Both, one is the reported completeness is 70%, and the actual death registration completeness was 67%. So reported completeness was calculated by using the registration total reported registered data and the total reported deaths within the households. And these are also highly covariate within positively covariate within the subnational levels. You can see here, except a few provinces like Province 2 and the Karnali province. They have some issues, so I will discuss later on in the discussion section what is the reason behind this outlier kind of data. Next one, please. These are the results, summary of the results of our study. The younger deaths were found really having low level of completeness, around only 26% compared to the older ones above 45%. This is the thing we find there. It was really significantly low in all provinces except the Bagmati, which is the capital city where Kathmandu located. And for females, it was less, lower percentage than the males. And households education also played an important role. Illiterate have only 63%, and where household had higher education status, they have around 84% registration. And the communication facilities also played an important role, including the mobile phones, television, and other communication facilities. If the household has the access of those, more access and the more likelihood of the death registration. And the Karnali has the least, and the Bagmati province has the highest rate of registration. For your information, there are newly formed 7 provinces in Nepal. We did our analysis in provincial and the ecological belts, 3 ecological belts level. Next slide, please. The multivariate analysis results are quite similar to the bivariate ones. Like females are less likely registered than male deaths, and for younger age, they are less likely registered than the older ones. Compared to the province one, the Bagmati province has only higher likelihood of death registration than other provinces are lower likelihood. And urban rural status has no any significant prediction on the death registration. And when we analyze the cause of death, these are not standard cause, but the cause reported by the households. The pregnancy-related deaths predicted lower likelihood, and the other deaths like the unnatural kind of deaths, accidents, suicide, natural disasters have greater likelihood. And education, as I mentioned, plays an important role for, and the communication facilities also impacted the death registration. Next slide, please. So this is the another part of the analysis we did in our study. We separately analyzed the household and the service provider responses. As I mentioned, they were asked about the ways to improve the registration, civil registration in Nepal. These are like the accessing the major barriers and enablers of the death registration in Nepal. And this is really interesting. We got the interesting results here. Around 85% household registered deaths for some kind of the legal requirements, like to transfer property entitlement, social security purpose, like for example, for accessing the widow pension, and other legal provisions. And when you asked why you not registered deaths, and around surprisingly around 70% mentioned that no need to register. This is very important result for the policy point of view. Why people think that they don't need to register, and this should be, as I'll discuss later on. Ways to improve, ways to make civil registration more convenient. They're a bit similar, but a bit varying like responses from both households and service providers. We asked whether mobile registration camps would be better for enhancing the registration because of the geography of Nepal. So households were really in favor. 71% agreed they need mobile camps there. In Nepal, for different public service delivery, time to time government introduce different kind of mobile service camps, like the citizenship distribution and other kind of health service camps. So they agreed to and promoting online registration. The service providers, more than 52% suggested to promote the online registration. And today the registration of events in Nepal is done on the basis of the place of permanent residence, their legal residence status, and it might be the big barrier to register those deaths which occur away, because many people live outside of their residence, legal residence, and they deprived of the registration. Registration of the events in their household. So yeah, the place of residence occurrence both are in a 37 and 28%. Next slide, please. These are the conclusions and the discussion and the recommendations. The reason behind the gender gap in death registration. Male dominance in behind this reason is that the male dominance in property ownership. So still there is male dominance, noticeable male dominance in the property ownership, even though government has implemented different policies to encourage to have the property ownership on the name of female. So providing incentives for that as well, but still there is male dominance, and for the property entitlement inheritance, the death registration is mandatory to supply at that time. So this is one of the major reason for male dominance in birth registration, death registration. Sorry, and another is a widow pension. As I mentioned earlier, that there is a provision in social security scheme under the government of Nepal. Women of 60 year age get widow pension. So they to get the access that pension, they need to mandatorily supply the death registration system, death registration certificate of their husbands. Potential reason behind the gap in provinces is the lack of awareness. People still don't know what is the importance of the death registration and the timely registration. And majority of respondents replied, they don't need to register, so they didn't register. So this is one thing. And a high poverty gap within the different provinces. This also might be linked with the lower registration rate. Low literacy rates in different provinces, and geographical remoteness. This is another factor which might impact, because people have to walk for long distances to approach the nearest local registration office. So they avoid those distances and only register when they need. So this kind of the gap in the low registration completeness for some kind of socio-economic groups limit the utility of death registration data obtained from the CRVS system for those groups. So these have some policy, like utility, issues, because the completeness is really significantly low, and yeah, they might not support as a policy evidence. So possible interventions. As I heard from Dr. Shah, in the case of Bangladesh, they have really very robust kind of notification system. They introduced the local community health workers as a active notifier. So we also suggested to establish an active notification system. To date, only the households are the notifier, whether the death occurs in the hospital or the household or anywhere. So depending on households, and they only register when they need, is just reducing the death registration and a timely registration. And another issue is still I mentioned that the government of Nepal has amended recently their legislations, but still they are a bit flexible in terms of like the negligible late registration fees, and anyone can afford those and they can register anytime. So this should be revised, and yeah, another provisions like could be made stricter. Another thing is launching sensitization programs. I found this is while I was working there, these kind of initiatives have a very significant impact on the communities, because many of them don't know what is the impact. And after during the census, we run the sensitization, and they really it is quite effective. And another is the deploying dedicated and a trained CRVS staff. At the moment, there are the staffs which have like the proximity of the movement, like transfer, is very high, because they can't retain within the local registration office, and frequent change might be the lack of the institutional memory, and yeah, and there is lack of CRVS related training among the staff. And one more thing we noticed there is the lack of the trained staff who can generate the vital statistics within the civil resistance department and at the local levels and the provincial level. So this should be taken in mind, and making registration compulsory for wider range of services. Today, there are very limited kind of services for which the death registration certificate is mandatory, like getting the social security access or for inheritance or like the property entitlement transfer. But there are many other services that I heard from the other contexts like Bangladesh. You can make mandatory the death registration certificate to access them, like the health services and other one like build a mechanism for the involvement of hospital and police as notifiers in the CRVS system. So still the deaths occurred in the hospital and the police in the record of police, they are not notified systematically. And only if the household have information, they notify that it is notified, and otherwise they remain unnotified and unregistered. So this is another reason, or say they should be included in the CRV system as a notifier. And and for this, government has initiated for the birth registration in a pilot phase for some major hospitals to report directly the birth occurred in the hospital to the CRVS system, but death is still not registered from those hospitals. Next, please. The limitations of this study are the results are based on the household responses, and there might be the respondents, like bias, and we have to believe on what they mention, and different kind of bias might be there. Study was bit old, like 8-year-old survey, and might not be relevant at this present context because now there is vast change in the CRV system. Government is implementing, for example, online registration system is progressing rapidly, and the importance of studies results are important for understanding the strength and weaknesses of CRV system in Nepal, identifying the major bottlenecks for national CRVS system development, and achieving the CRVS decade goals, and valuable evidence for CRVS system efforts in other low and middle income countries facing similar challenges like Nepal. Next one, please. Yeah, thank you very much for your patience and hearing me. Any questions, please?
Thank you so much. This was really, really interesting. You went a little bit over time, but that's okay. But it does mean that I think we won't have time for plenary questions. But the next step for today is to go into the Ask the Author sessions. So basically this means that we've created some breakout groups, and we'll be sharing the links to those breakout groups in the chat box, and they're also available on our website. So basically these breakout groups are opportunity to ask in-depth questions and have a good discussion with the authors on their research. We hope that these provide you an opportunity to clarify any questions you may have regarding the authors' presentations and research. We have assigned authors to one individual breakout rooms each, and these authors will be supported by an ESCAP colleague as well. All of the participants who are not authors can choose which room to enter at any point, and you're also very welcome to shift between the different rooms if you want to hear from more authors. We will be recording these discussions, but only for our internal use, not to, these will not be put on the website, just for our internal use. So we're very much hoping to have some informal discussions in these groups, and also to create some linkages between different practitioners and researchers working on similar issues across the region. So we are sharing the links to the groups If I could, yeah. So here you have the links to the groups, and they're also in the chat box, and they are on the website. So basically what you do is that you click on the one on the meeting room that you would like to join. So if you're mainly interested in Ariel's presentation on the engagement with children and youth, you go into room 2, and you click the room 2 button here in the chat box. And then you can join that room for as long as you want. We are finishing this session at 12, sorry, let me just check that, 11:30. Yeah, so we have about half an hour. So you join that group as long as you want, and then if you want to listen and join other groups, you can move across. And after 11:30, we will have a break. So you get a chance to have lunch or breakfast or whatever time it is where you are. And then we will go back to the third main session on equity, which will start at 1:30 Bangkok time. And that you can access using the main session link, which again is both in the chat box and on the website. So please join the different groups and hear more from the authors, and a huge thank you to all the authors who presented today, and also to Amanda who opened the session. It's been very insightful, and I really look forward to hearing more of the discussions that are happening in the breakout groups. So please, everyone, join the different groups. We have the 4 different rooms. Room 1 is for Neil Singh from Fiji. Room 2 is from Ariel from World Vision. 3 from Shah Ali Akbar Safi from Bangladesh, and room 4 is for Surendra Prasad Pandey from the University of Melbourne and Nepal, on the survey done in Nepal. So please move across, and